Welcome to Tutorial Zone, where we simplify complex concepts. Before we dive deeper into this lecture, please make sure you subscribe, make sure you like, make sure you comment, make sure you share, and turn on your notification button so that every time I post a new video, you should be updated. This video is a continuation and part 2 of Anatomy and Physiology of the Cardiovascular System. In this video, we're going to look at the white blood cells. I am Dr. Said Piri, so let us begin. By the end of this lecture, you are expected to do the following: to describe the structure of white blood cells, to describe the functions of white blood cells, and to describe the production of white blood cells, also known as leukopoiesis. We can now look at the introduction to white blood cells. The first and most important concept that I would like you guys to understand is that white blood cells are different from red blood cells. From our previous video, from our previous discussion, I mentioned that red blood cells possess or they have a protein known as hemoglobin, but they lacked two things. They lacked the nucleus. They didn't have a nucleus, or they don't have a nucleus, and they also don't have cell organelle. Based on these three, white blood cells or leukocytes do not have hemoglobin. So white blood cells lack hemoglobin, but they have a nucleus and they also have cell organelles. So this is how white blood cells are different from red blood cells. These white blood cells or leukocytes are classified into two classes: granular leukocytes or granulocytes and agranular leukocytes, also known as agranulocytes. This classification is based on two things. It's either the white blood cells have granules or they do not have granules. So the classification is based on the presence or the absence of granules. Now, what are these granules? These granules, also known as vesicles, are components in the cytoplasm of these white blood cells that possess or that contain chemicals in them. The best analogy or the best example that I can use here is that you can think of these vesicles or granules as small plastic bags that contain materials inside them, or you can think of them as pockets that contain materials in them. For example, the materials that you can have, these granules can have enzymes, they can have chemical mediators such as histamine and so on. So if a white blood cell has these vesicles, or they have these small plastic bags or pockets that contain materials in them, they are known as granular or granulocytes. If they don't have these granules, then they are agranular or agranulocyte. There are different types of white blood cells. So those that possess granules, the granular leukocytes, are the neutrophils, the eosinophils, and the basophils. The mnemonic to remember granulocytes or granular leukocytes is BEN. B for basophils, E for eosinophils, N for neutrophils. Then there are granular leukocytes, they are the lymphocytes and the monocytes. Later on in this video, even in the previous video, I mentioned the different types of lymphocytes, and I'm going to mention them later on again. This diagram here is showing you the different types of white blood cells, both the granulocytes and the granulocytes, and how they look like under the light microscope. So you stain these white blood cells with a dye, and then you see them under a light microscope, and what you are seeing here is exactly what you are going to see under a light microscope. So starting with the granulocytes. The granulocytes, which are the neutrophils, the eosinophils, and the basophils, you have to understand that those granules that are present within the cytoplasm of these cells have different sizes, and they also have distinct colors. They have colors that are specific to a type of white blood cell that you are looking at. The nuclei also have got different shapes. They have got different numbers of lobes, which are specific to the type of white blood cell that you are talking about. Starting with a neutrophil, you're going to find that the nucleus of a neutrophil has about 2 to 5 lobes. In this case, this neutrophil that we have has about 4 lobes. It has this lobe here, it has that lobe there, it has this lobe, and it also has that lobe. And these lobes are actually connected by genetic material. Then the granules of the neutrophil are smaller in comparison to the eosinophil and the basophil, and the color of these granules is pale, so they are lighter in terms of their color. If you look at this in comparison to the other ones, you realize that these ones are much more lighter. They are pale in their color. Then coming to the eosinophil has a nucleus with 2 lobes, and these lobes are actually connected by genetic material. They actually look like headsets, if you ask me. And then the granules of these eosinophils are very large, and they are bright red in color, and they actually have the same size as well. Then with the basophils has rounded granules that have got different sizes, and these granules actually spread out in the whole cytoplasm in such a manner that they tend to obscure, they tend to cover the nucleus. You cannot see the nucleus properly, but this nucleus in the basophil is similar to the eosinophil. It has about 2 lobes as well. Then with the lymphocytes, which are granulocytes, we are talking about granulocytes. Really, they do have granules, but these granules are very small, and they have low quality in terms of staining. They have low quality properties in terms of staining. They don't stain properly, and therefore you cannot see them under a light microscope. But a lymphocyte has a dark nucleus that is surrounded by a cytoplasm. The cytoplasm forms a rim around this nucleus. Then with the monocyte has a nucleus that is horseshoe or kidney shaped, and this monocyte has what are known as azurophilic granules. Azurophilic granules are not granules that are in comparison to the granules that we're talking about. These ones are actually the lysosomes of these monocytes. They have those digestive enzymes that tend to help in fighting off infection. This diagram here is showing the process of formation of white blood cells and other formed elements. But what we want to concentrate on is the formation of white blood cells. The process by which white blood cells are produced is known as leukopoiesis. So when the pluripotent stem cell differentiates into the myeloid stem cell and the lymphoid stem cell, some white blood cells develop from the myeloid stem cell, while others develop from the lymphoid stem cells. The granulocytes and the monocyte develop from the myeloid stem cell. When this myeloid stem cell becomes a colony-forming unit, this colony-forming unit differentiates into different blasts: this first blast, the second blast, the third, and the fourth blast. The first 3 blasts give rise to the granulocytes: the eosinophil, the basophil, and the neutrophil. And then the fourth blast gives rise to the monocyte, which uses the blood mostly as a conduit or as a passage, and then it goes to the tissues. For example, it can go to the connective tissue, where it differentiates and it matures to become a macrophage. We're going to look at the functions of that later on. Then the lymphocytes and the natural killer cell, they develop from the lymphoid stem cell. So the T lymphocyte, which is the T cell, the B lymphocyte, and the natural killer cell, which are the granular leukocytes together with the monocyte, these three develop from the lymphoid stem cell. So this is how the process of leukopoiesis occurs in the red bone marrow. We can now talk about the functions of these white blood cells. But before we go into the individual cells, we're going to have to discuss a few important concepts. So I would like you guys to understand that white blood cells, in the absence of an infection or a disease in the body, they can live for about several months to years, especially for the lymphocytes. However, most of them, they live for few days. In the presence of an infection, some white blood cells, such as the phagocytic cells, the ones that actually eat up the invading microorganisms, such as the macrophages, they can live even for just a few hours, because as they are fighting off these invading microorganisms, they get damaged and then they get to be removed from the body. Now, in terms of white blood cell count, when you compare the white blood cell count of white blood cells to red blood cells, we are going to realize that the white blood cell count is actually less numerous. There are few white blood cells in comparison to the red blood cells. The total count of white blood cells is about 5,000 to 10,000 cells per microliter, while the red blood cells are about 5.8 million. About 5.8 million cells per microliter. So you can see the highest value 5.8, and here it's about 10,000 cells per microliter. So you can see that red blood cells are even more numerous in comparison to the white blood cells. However, in certain circumstances, the white blood cell count can increase beyond 10,000 cells per microliter, and this increase in white blood cell count above 10,000 microliter is known as leukocytosis. And this leukocytosis can actually be because of several factors, for example, infection or a response towards an invading microorganism. We can actually talk about surgery. We can talk about things such as strenuous exercise, anesthesia. All these can actually increase the white blood cell count. Then, in some circumstances, though this is not usually beneficial, the white blood cell count can actually be less than 5,000. It can be less than 5,000. That is a low white blood cell count, which is known as leukopenia. And this can actually occur in situations such as shock, where someone has received radiotherapy or radiation, someone has received chemotherapy, they can have a low white blood cell count. And then the way differential white blood cell count helps in diagnosing different diseases, especially infections, where a physician orders for a blood of the patient to be screened for the percentage of this white blood cell count. So we're going to talk about that in just a few slides from now, but that's what a differential count is all about. The white blood cells have the main function of fighting off infection or removing invading microorganisms. Let's take, for example, a bacteria, and this bacteria infects the muscle cells. This infection is outside the bloodstream where the white blood cells are not present. The white blood cells are present within the blood. So how are these white blood cells able to fight off that infection that is in the muscles outside the blood vessels? These white blood cells have the ability to leave the bloodstream and go to the site of infection. And the process by which the white blood cells leave the bloodstream and go to the site of infection is known as emigration or diapedesis. So this process of diapedesis happens in three important steps: rolling, sticking, and squeezing. So before we talk about those steps, I would like you to understand that normal blood flow happens in a way that the white blood cells are at the center of the blood. As the blood is flowing, the plasma is on the sides, and then the white blood cells are actually at the center. So this process of emigration or diapedesis happens when the neutrophils, for example, get closer to the endothelial cells. So first the neutrophil gets closer to the endothelial cells, and then they start to roll on these endothelial cells. So the first process or the first stage of emigration is known as rolling. The white blood cell gets closer to the endothelial cells, and then they start to roll. They start to roll the same way a ball rolls. They start to roll on those endothelial cells. Then as they are rolling, later on they start sticking, they start binding to the endothelial cells, and then they start sticking to these endothelial cells. Then later on now, they're going to squeeze in between. They will come out of this blood vessel by squeezing in between the spaces that are present between the two endothelial cells. So there's this endothelial cell, there's this endothelial cells, the space in between those, the white blood cell has the ability to change shape and then squeeze through those endothelial cells to go to the site of infection. So this is how diapedesis happens, or this is how the white blood cells leave the bloodstream to go to the site of infection. We can now spend time talking about the specific functions of these white blood cells. I'm not going to talk about the structure because I've already mentioned about the number of lobes of the nucleus. I've already mentioned what type of granules each white blood cell has, and so on. So we'll start with the granular white blood cell. The first one is the neutrophils. You have to understand that neutrophils are the most abundant, they're the most numerous WBC in comparison to other white blood cells. You can see that they're about 60 to 70% of all white blood cells. What's their function? The function of these neutrophils is very much important in fighting off bacteria. So they have these lysosomes and other chemicals that they release that help in fighting off this bacterial infection. So when someone has got an increase in the neutrophil count, you have to suspect that that individual might have a bacterial infection. With eosinophils, they are about 2 to 4% of all white blood cell count, and these eosinophils are very much important in that they are important in allergic reactions, and they also, most importantly, help in fighting off parasites, the large worms. And what this means is that if someone has got an increase in their eosinophil count, you have to suspect that that person most likely has a parasitic or a worm infection. Then with basophils, they are the least numerous. They are not easily found. They are about 0.5 to 1% of all white blood cell count, and these basophils are very much important in that they have these granules that contain chemicals such as heparin, histamine, and serotonin, and these are very much important in allergic reactions. They are mediators of allergic reactions. So if you find that someone has got a high basophil count, most likely that person is having an allergic reaction. Another cell, the mast cell, similar to basophil in that it also has heparin, histamine, and serotonin containing vesicles. This mast cell is very much important also in allergic reactions. It is found in tissues, and this mast cell generates or is produced from the progenitor stem cell. From the progenitor stem cell, if I have to be specific, that actually comes from the myeloid lineage, just like the granulocytes themselves. So mast cells is similar to basophils in terms of content as well as in terms of function. We can now shift our attention to the granular white blood cells, and we're going to start with the lymphocytes. There are three types of lymphocytes: T cells, the B cells, and the natural killer cells, and these make up about 20 to 25% of all white blood cells. Now, these cells have got different functions. For example, the B cells can differentiate into plasma cells, and these plasma cells secrete antibodies. Antibodies are a type of globulins. They are important in binding to an antigen, and then that leads to an immune response. The T cells are also very much important in fighting off viral infections, cancer cells, and also they're important in organ transplant. For example, if someone is given an organ that they are not compatible with, that organ is going to be attacked because it will be considered as foreign. and it is these T cells that help in fighting off such transplanted or foreign organs that are not matching with the recipient. So you have to also understand that these natural killer cells also play an important role in fighting off tumor cells or cancer cells. So supposing an individual has high T cells, it's either they're having a viral infection or they're having a cancer, or those individuals are actually having a transplanted organ that is being rejected and the T cells have gone high. If someone is having a lot of natural killer cells, it could also be that they are fighting off a tumor that is increasing the levels of these natural killer cells in the blood. Then we're talking about monocytes. They're about 3 to 8% of all white blood cells. And if you remember, monocytes, when they go to the tissues, they become macrophages. And these macrophages are very phagocytic. They are phagocytes, similar with neutrophils. They are also phagocytes. It means they eat or ingest, they ingest the invading microorganisms. Phagocytosis means cellular cell eating. So they eat up these invading microorganisms. If it's a bacteria, they'll eat it up. If it is other types of invading microorganisms, they can also be taken up by these phagocytic cells. So monocytes become macrophages when they enter the tissues and they perform the function of phagocytosis. So this diagram is actually summarizing whatever I've talked about. But I like this particular diagram because it actually shows you in what circumstances do you have high white blood cell count and in what circumstances do you have low white blood cell count. So my biggest thing that I can talk about here, or the most important thing that I can talk about here, is HIV infection. Remember in the previous slide I mentioned that lymphocytes, especially the T cells, can actually have a high white blood cell count in cases where there is a viral infection. But the HIV infection, even if it's viral, it is actually very different in that it gives you a low T cell count. Then you can take time and look at other things here. But for neutrophils, I'd like you to remember that they are high in a bacterial infection. For lymphocytes, they are high in a viral infection. Monocytes also high in viral as well as the tuberculosis infection. Eosinophils, they are high in allergic reactions and parasitic infections. Basophils are also high in allergic reactions. I think those, I would like you guys to remember them the most. But these are the ones you can actually take time and look at them on your own. We have come to the end of this video, which is part 2 of blood. In this video, we have talked about white blood cells. We have talked about their structure. We have talked about their function. We have also talked about how they are produced in the red bone marrow. In the next video, we're going to look at platelets. Stay tuned. Make sure you subscribe, you share, you like, you comment. See you in the next video. Thank you very much.